Hi viewers, this is J. Swami, Assistant Professor of Zoology. In this class, we are going to discuss another important endocrine gland, namely thyroid gland. Here, we are visualizing the thyroid gland. The thyroid gland consists of two lobes. Thyroid gland consists of two lobes. These two lobes get connected by a narrow band-like, stalk-like structure which is known as the isthmus. This is known as isthmus. There are two lobes in the thyroid gland get connected by a band-like structure which is called as the isthmus. And see the location of the thyroid gland. The two lobes are located on either side of the trachea. This is the trachea we are observing. So entire it is the trachea. So on the either sides of trachea, these two lobes are present. And these are just inferior to the larynx. So here it is a larynx, chatterbox. So just inferior to the larynx, we will find out the thyroid gland. This thyroid gland is one of the largest endocrine glands with a weight of approximately 20 grams, and it is highly vascular and appears red than the surrounding tissues. It is looking bright red due to the higher vasculature. And if you see the internal structure of the thyroid gland, have a look at this diagram. We have taken a section of the thyroid gland. This thyroid gland contains numerous follicles. So these all are the different follicles of the thyroid gland, which are pear-shaped, and the walls of the follicles are composed of single layer of cuboidal epithelium tissue. Cuboidal epithelium tissue. Each and every thyroid follicle, it is filled with a protein called the thyroglobulin. Thyroglobulin. This thyroglobulin synthesized and secreted by the cells of the thyroid follicles, and large amounts of the thyroid hormones are stored in the thyroid follicles as the thyroglobulin molecules. If you observe furthermore, between the follicles, so here all these are the follicles. Between the follicles, a delicate network of loose connective tissue contains scattered cells which are known as the parafollicular cells. Parafollicular cells. These parafollicular cells are also known as the C cells. Parafollicular cells, otherwise they are also called as the C cells. Now here the hormones of the thyroid gland. There are three hormones. One is the T3, otherwise triiodothyronin. General name is thyroxine, but it is existing in two forms. Triiodothyronin. There are three iodine molecules to the tyrosine. And another one is T4, tetraiodothyronin. 4 iodine molecules are present. Triiodothyronin, commonly called as T3, and tetraiodothyronin, T4. What is the difference in between these two? T3 hormone is inactive, but it is more stable at the target cells, whereas the T4 is more active but unstable at the target cells. However, the most widely used form is the T3 form only. Triiodothyronine form is the most widely used form. Then, if you observe the third one, calcitonin, otherwise it is also known as the thyrocalcitonin. Thyrocalcitonin. Thyroxine, that is in two forms, T3 and T4, and the calcitonin, otherwise thyrocalcitonin, are the important hormones which are formed from the synthesized and secreted from the thyroid gland. How it is being produced? For example, here there is a hypothalamus. Hypothalamus produces TRH, thyroid releasing hormone. It acts upon the anterior pituitary. This anterior pituitary, upon stimulation, produces TSH, thyroid stimulating hormone. It acts upon the thyroid gland, especially thyroid follicles, okay, and it produces all the three kinds of hormones: triiodothyronine, tetraiodothyronine, and the thyrocalcitonin. Then here the main important factor, that is TSH, stimulates the production of thyroxine, and also it makes the release of thyroglobulin, otherwise the thyroxine, into the circulatory system. Here it requires adequate amount of iodine in the diet. Why it is required? Because the thyroxine, as usually, it is in the form of triiodothyronine or tetraiodothyronine. So for the formation of the T3 or T4, we require adequate amounts of iodine in the diet. Then only these hormones are get synthesized. So this is a chief component of the T3 and the T4. If you observe the synthesis of the hormones, here you can observe this is the tyrosine. Here 1, 2, 3, 4 iodine molecules, tetraiodothyronine, and here 1, 2, 3 triiodothyronine. So thyroglobulin molecules that contains the numerous tyrosine amino acids. These are synthesized, packaged into secretory vesicles and secreted to the lumen of the follicles. Iodine atoms are bound to a few of the tyrosine amino acids of the thyroglobulin, producing monoiodotyrosine first, which has only one iodine atom. So here tyrosine get attached to only one iodine first, then thereby it becomes monoiodotyrosine. Then becomes 2 diiodotyrosine, which has only 2 iodine atoms. After the tyrosine are iodinated, then thereby it forms the 2 diiodotyrosine molecules combined to form the tetraiodotyrosine, tetraiodothyronine otherwise, which has 4 iodine atoms. Thyroglobulin is taken into the thyroid follicle cells by the endocytosis process. Lysosomes fuse with the endocytic vesicles and proteolytic enzymes break down the thyroglobulin to release T3 form, otherwise T4 form. They release the T3 form or T4 amino acids, and all these T3, T4 are lipid soluble and diffuse through the plasma membrane of the follicle cells into the interstitial fluid. Finally, they released into the blood. So this is the thing what happens inside the thyroglobular cells. This T3 and T4 thyroxine, that is triiodothyronine, are the identical hormones. They are derived from the amino acid tyrosine. They act at the cellular level and increase the body's basal metabolic rate, BMR, basal metabolic rate, by accelerating the oxidation of carbohydrates. Thyroxine is also called as the T4, otherwise tetraiodothyronine, as it contains 4 iodine atoms. It is more active but unstable target cells. It is broken down quickly after its job. So triiodothyronine contains only 3 iodine atoms and density is called T3. It is inactive but more stable at the target cells. And just now we discussed T3 form is the most widely used form of thyroxine in all the cells. Here if you see the disturbances, otherwise abnormalities of the thyroid gland. Here it may be hyperactive or hypoactive. It may be hyperactive, otherwise underactive, hypoactive. The hyperactivity of thyroid cells leads to a condition which is known as hyperthyroidism. Hyperthyroidism, whereas the underactivity it called as hypothyroidism. Hyper, more amount of thyroid is released. Hyperthyroidism. Hypo, less amount of, deficient amount of thyroxine get released. Here in the hyperactivity what happens, generally it is called as hypothyroidism. It may lead to the Graves disease. It is an autoimmune disease. Hyperthyroidism is a abnormal increased secretion of the thyroid hormones. It causes the Graves disease. Graves disease is an autoimmune disease that produces a specific immunoglobulin called thyroid stimulating immunoglobulin, TSI, thyroid stimulating immunoglobulin. Hypersecretion of thyroid hormones increases the rate of metabolism, high body temperature, weight loss, increased appetite, rapid heart rate, elevated blood pressure, muscle tremors, diarrhea, insomnia, and hyperactivity are the major symptoms of the Graves disease. That is a hyperthyroidism. And one more you can see, that is a exophthalmic goiter. Exophthalmic goiter is the bulging of the eyes that often accompanies the hyperthyroidism and is caused by the deposition of excess connective tissue. Here you can see exophthalmic goiter is the bulging of the eyes that often accompanies the hyperthyroidism and caused by the deposition of the excess amount of the connective tissue behind the eyes. The excess tissue makes the eyes move anteriorly. Consequently, they appear to be larger than the normal size. That is the exophthalmic goiter. It is also accompanied by the hyperthyroidism. Then, if you see the hypothyroidism, it is a reduced secretion or non-secretion of the thyroid hormones. It can be caused by the inadequate amount of the TSH or inability of the thyroid gland to produce the thyroid hormones, or some of the times it may be the adequacy of the iodine that leads to the goiter. Hyposecretion of thyroid hormones decrease the rate of metabolism, low metabolic rate. Hypothyroidism, low metabolic rate. And low body temperature, weight gain, reduced appetite, reduced heart rate, reduced BP, decreased muscle tone, constipation, drowsiness, and apathy are the major symptoms of the disease. And if you observe the myxedema is the swelling of the face and body, and the body parts as a result of mucoprotein deposits can occur. If hyposecretion of thyroid hormone occur during the development, there is a decreased metabolic rate, abnormal development of the nervous system, abnormal growth, and abnormal maturation of tissues, resulting in mentally retarded person of short stature and distinctive form called as the cretinism. It is called as the cretinism. That is, some of the times what happens, the hyposecretion in the case of children in the childhood stage, that leads to the congenital hypothyroidism, otherwise cretinism. We should very careful while discussing the pituitary dwarfism and the thyroid cretinism, because The people, students, often get confused. Pituitary dwarfism is the disorder which is due to the deficiency of the growth hormone, somatotrophic hormone. So that is, all the body parts may be grown in a harmony, but they are looking very short, dwarf. All the body parts may be well developed, but in the case of cretinism, which is due to the hypothyroidism of the children, that leads to the abnormal development of the nervous system. The nervous system may not properly developed, and abnormal growth and abnormal maturation of the tissues, and that may lead to the mental retardation of the child, and they look like a dwarf within the short stature, and this form is called as the cretin, and the disease is called as the cretinism. So we should not forget, we should not confuse with the dwarf and the cretin. Dwarf, all the body parts are well developed, but they are grown very short, whereas the cretin, so abnormal growth of all the body parts along with the mental retardation we should not forget. And here we will see the calcitonin also. Otherwise, later I will discuss. See, the thyroid disorders may be classified as hyperthyroidism, that is thyrotoxicosis, overproduction of thyroid hormone, hypothyroidism, that is the gland destruction, underproduction of the thyroid hormones. If you observe the signs and symptoms of the hyperthyroidism: protrusion of one or both eyeballs, exophthalmos, breathlessness, then nervousness, difficulty in sleeping, insomnia, fatigue, itching, and protruding eyes, hair loss, staring gaze, nausea and vomiting, warm moist skin, goiter, fast heart rate, trembling of the hands. These all are the signs and symptoms of the hyperthyroidism. If you see the signs and symptoms of the Graves' disease: fine tremors of the hands or fingers, anxiety and irritability, increased sensitivity to heat, increased perspiration and moist skin, weight loss, goiter, enlarged thyroid gland, bulging of eyes, that is Graves, ophthalmopathy, rapid or irregular heart rate, palpitations, thick red skin usually on the chins or top of the feet, Graves' dermopathy, erectile dysfunction or reduced libido, frequent bowel movements. These all are the signs and symptoms of the Graves' disease. So this is the exophthalmic goiter. And signs of the hypothyroidism: so psychologically, poor memory and concentration, poor hearing, and pharynx hoarseness. If you see that heat, slow pulse rate, pericardial effusion, muscular, that is delayed reflex relaxation, and extremities, coldness, then carpal tunnel syndrome. Generally, fatigue, feeling cold, weight gain with poor appetite, hair loss, and shortness of breath, pleural effusion, then paresthesia, myxedema, constipation, ascites, and menorrhagia. So these all are the signs and symptoms of the hypothyroidism. So this is about the myxedema, that is temporary swelling of the body parts, swelling of the body parts and the other regions of the body. Then coming to the goiter. Generally, goiter is a enlargement of the thyroid gland. It develops due to the chronic hypersecretion of the thyroid hormones. That is, increased TSH production by the pituitary tumors results in continuous and overstimulation of the thyroid gland. thyroid hormone synthesis increases and thyroid gland cells increase in size and number, producing goiter. Hypothyroidism caused by an iodine deficiency in the diet can also cause the goiter. Without adequate iodine to synthesize thyroid hormones, blood vessels, otherwise the blood levels of the thyroid hormone decreases. The reduced negative feedback of thyroid hormones on the anterior pituitary and hypothalamus results in elevated levels of the TSH secretion. This TSH causes increased thyroid gland cell size and number and increased thyroglobulin in synthesis, even though there is not enough iodine to synthesize thyroid hormones. Goiters are common in people from areas where the soil is deficient in iodine. Iodized salt has nearly eliminated iodine deficiency goiters. So here enlargement of goiter that is seen. See here. So this is a cretinism. It is due to the lack of thyroxine from birth or before the birth. Could be from lack of thyroid gland some of the times, or lack of iodine in mother. Severe and irreparable mental defects, stunted growth, reduced growth and function of many organs. Deficiency of the thyroxine hormone in infant or intrauterine periods that leads to the cretinism mostly affected development of cerebral cortex, especially the parts of the central nervous system, cerebral cortex, basal ganglia and cochlea-like structures of the ear, loss of hearing, CNS excitation, motor activity, learning capacity, memory, response stimulus. So there is a loss of all these activities due to the cretinism. Here we have compared the symptoms and signs of hyperthyroidism and the hypothyroidism. So most of them they are equally opposite to each other. So this is all about the thyroxine hormones. Let us see one more thing, that is calcitonin. Calcitonin is also known as the thyrocalcitonin. This thyrocalcitonin is released based upon the calcium levels of the blood. Calcitonin regulates the calcium levels in the body fluids. Here there is a disease which is known as the Paget's disease, where calcium deposition is disturbed in the bone. This is treated effectively by the administering the calcitonin hormone. That is, calcitonin or thyrocalcitonin is the hormone produced from the thyroid gland. It is basically secreted from the parafollicular cells. Just now we discussed the C cells, and plays a major role in reducing the concentration of calcium in the body fluids. When the calcium level becomes elevated, then thereby it reduces the calcium levels. Calcitonin secretion is directly regulated by the blood calcium levels. As blood calcium concentration increases, calcitonin secretion increases. Whereas blood calcium concentration decreases, calcitonin secretion is decreased. That is, calcitonin binds to membrane-bound receptors of the osteoclast cells of the bone and inhibits them, which reduces the rate of bone matrix breakdown and the release of calcium ions from the bone into the blood. So this is effectively used in the Paget's disease. That is, Paget's disease is effectively controlled by the administration of calcitonin. So this is all about the thyroid gland. So that is thyroid gland structure, synthesis of the thyroxine T3, T4 forms, and the disorders like the hyperthyroidism, that is Graves' disease and myxedema, exophthalmic goiter, and also the cretinism. So these all are the things related to the thyroid gland. Thank you one and all.